Good morning everyone. Today topic joints and its classification. Joints are points of contact between bones. For example, here if there are two bones and these two bones are connected to each other like this, here we have joints. So this region is called joints. So joints are a point of contact between bones. Or also we can define, and it is a region between bones and cartilage. The region between bones and cartilage also we can use the term joints. So what is the role of joints function? So these joints are essential for all type of movement. They are essential for all type of movement involving the bony part of the body. And they act as, these joints are act as fulcrum. Very important. They act as fulcrum. Here fulcrum means supporting point. They give support. There is an important two notes. Here joints are known as fulcrum. Bones act as levers. Means they are rod shaped and they support to the weight. And for example, muscles known as effort. Here effort means they undergoes contraction of muscle for movement. So they undergoes contraction of muscles. They undergoes contraction of muscle for movement called effort. And this effort act by the muscles and levers act by the bones and fulcrum act by the joints. Here. Now we move on classification of joints. Classification of classified into three types based on degree of mobility and the tissue connecting them. Based on this, joints are classified into three types. That first one, fibrous joint. Second one, cartilaginous joint. Coming to third one, synovial joint. First, we discuss in detail about fibrous joint. So these fibrous joints are also known as immovable joint or also called sin. And in fibrous joint, there is no gap between bones. In which no gaps between bones. In this joint, there is no gap between bones. Hence, they are immovable. Hence, no gap between bone. Hence, no synovial fluids are present. So here between joints, between joints in fibrous joint, there is a connective tissue is present, that is fibrous connective tissue is present. Now we move on various example of fibrous joint. Here I am writing examples of fibrous joints. For example, sutures. And these sutures generally present between cranial bones. So there are 8 cranial bones are there in the head region in skull. So between cranial bones we have seen these sutures. So these suture joints are connect different types of bones in cranium, like it connect frontal bone, parietal bone, temporal bones, and occipital bones. In between these bones, there is no gap, and they are immovable bones. These bones, and there we have seen one type of joints. That joint is called sutures. And one more example type of fibrous joint, that is syndesmosis. Here, syndesmosis generally which is present between tibia and fibular joints. So these tibiofibular joints are present in hind limb. For example, in hind limb we have femur bone, and below which we have tibia and fibula. So between these two there is a joint. The joint is called syndesmosis joints. And one more example for fibrous joints, that is gamphosis. So this gamosis present between dento joints. So here dentoalveolar joints means in which, for example, in a tooth part there is a socket like structure like this, and this is called alveoli. So here alveoli, don't confuse. Alveoli is a structural and functional unit of lungs, but here there is a socket like structure in tooth, that is called alveoli. In this socket the tooth will be inserted like this. So this is alveolar joint. Here we have the joint between this teeth and alveoli. So here we have seen this dento joints. So alveolar here nothing but alveolar socket, or it is a socket of tooth. So these are the different types of fibrous joints. There are sutures present between cranial bones, and syndesmosis present between tibia and fibular joints, and gamphosis which is present between dento and alveolar joints. So this is all about the fibrous joints. Now we move on another important joints, that is cartilaginous joint. Yeah. So second one, cartilaginous joint. So these cartilaginous joint are also known as, it has various names. It is also known as slightly movable joint. Slightly movable joints are also known as amphiarthrosis. Amphiarthrosis. So in this joint, there are slight gap between joints. Slight gap, little gap between bones, but no synovial fluids are present. No synovial fluid is present. Here, between joints, there is a connective tissue is present, that is cartilaginous fibrous tissue is present. Cartilage, fibrous, connective tissue is present. Now we move on. Various examples for cartilaginous joints. Yeah, example. First, most important example is pubic symphysis. So this pubic symphysis, generally which is present between pelvic girdle, are also called coxal bone, and at hip region. For example, these pelvic girdle or coxal bones are generally made up of with three fused bones. Here we have only one pair of pelvic girdle. For example, like this here. So this is one bone and another bone, one side, and from like this, here, like this. So here one pair, and this side one, this one, another one, and these two, one pair of pelvic girdle or coxal bones, and each coxal bones are made up of with three different fused bones. Here, like ilium bone, ischium bone, and here pubic symphysis bones. This side also ilium bone, ischium bone, and pubic symphysis bone. So this cartilaginous joints, this present between pubic symphysis here. Between pubic symphysis means here we have seen this cartilaginous joints. And second most important, and this cartilaginous joint also present in intervertebral disc. Here intervertebral disc is between adjacent vertebral column bones, which is present adjacent vertebral column bones like this. So here we have various vertebral column bone. Between these two, here like this we have cartilaginous joint. And also these cartilaginous joints, here I am right. Sorry, we will take another slide. Yeah. Third example for cartilaginous joint, sternodisc. A sternovertebral disc means here the joints which is present between vertebral bones and sternum bones. For example, here we have like this sternum bone or chest bone, and there are 12 pair of ribs bones are there. So like this 12 pairs, yeah, and these 12 pairs of ribs bones, one side which is attached to the vertebral column and another side which is attached to the sternum bones. So there we have seen this type of sternovertebral disc bones, and these joints are present between sternum bones and vertebral bones. Now coming to fourth and the last most important, that is which is also present at the end of the epiphyseal plate, end of the long bone. So generally we have like this long bone. The end of the long bone is called epiphysis. Here I am writing. The end of the long bone is called epiphysis. So at this region, we have seen a type of joints called epiphyseal joints. And epiphyseal joints means nothing but they are cartilaginous joints. So here we have physeal plate only. We have seen cartilaginous joint. So these are the important four regions where we have seen this cartilaginous joint. Okay. So now we move on. One more important types of joint. It is the most important joint, that is synovial joint. Yeah. Third one, synovial joint. So the synovial joint also have various other names, like they are also known as freely movable joint. Or also we can use another term. This synovial joints also known as die. And here in synovial joint there is a gap between bones. Hence there is a fluid which is present in this gap called synovial fluid. Hence synovial fluid is present. And this synovial fluid which is secreted from the synovial membrane. Okay, we will discuss the structure of synovial joints and types of synovial joints. Structure of synovial joint. Yeah. So here we have two long bones, and these two bones are connected to each other with the help of a specialized connective tissue. Yes. So this specialized connective tissue is called ligaments. So this ligament is a specialized connective tissues which connect two bones. And note, there is a more connective tissues called tendon. So this tendon which connect bones and muscles. Yes. So with the help of ligaments, these two long bones are connected to each other, and there it forms this region called joints. And after formation of this joint by with the help of ligaments, and there is a cavity between joints. Now this cavity is called synovial cavity. This cavity is called synovial cavity, and this synovial cavity covered with a membrane. Here I am drawing. Yes. So the synovial cavity completely covered with a membrane. Yes. This membrane is called synovial membrane, and this synovial membrane play important role. Secrete a fluid. The fluid is called synovial fluid. So like that, the synovial fluid which is present here, and the synovial fluid secreted from the synovial membrane is around the synovial cavity. And a very important, the synovial fluid has various important components. So here we will discuss. Here it has the synovial fluid contain hyaluronic acid, and also it act as lubricant, and also it act as shock absorbent, and very important. And these joints, the synovial fluids present between bones for prevent frictions. So it prevents friction between bones. Prevent friction between bones. And very important, one more fifth point here I am writing. So that is, it has a nature of phagocytosis. Phagocytic nature. Mean if any microorganism which invade into this region, then this synovial fluid which kill this micro by protecting this fluid. So all these five important role of the synovial fluid is the synovial fluid present between the joints. So due to presence of the synovial joint or fluid, and then these joints are freely movement. So this is all about the structure of synovial joint. Now we will move on types of synovial joints. Yeah, types of synovial joints. Generally, we have six types of synovial joints. Six types of synovial joints. There, first one is ball and socket joints. Ball and socket joint. So this ball and socket joint, example which is present at shoulder joint, is present at shoulder joint, and also it is present at hip joint. Here, shoulder joint means between humerus bone and pectoral girdle bones. These joints are present between humerus and pectoral girdle bones. Generally here there are two pairs of pectoral girdles we have. Two pair means there are four, like scapula and clavicles. So two scapula bones and two clavicles bones. These four together called pectoral girdle. And between pectoral girdle and humerus, we have seen a joint called shoulder joint. And shoulder joint is an example for ball and socket joint. Now coming to hip joint. So this hip joint present between femur bone and pelvic girdle. Very important. Pelvic girdle. Humerus and pectoral girdle, that is shoulder joint. In between femur and pelvic girdle is hip joint. Here pelvic girdle is only one pair, means two. And this pelvic girdle is also known as coxal bone. Coxal bone. And these coxal bones are made up of with three fused bones. Like they are ilium bone, ischium bone, and pubic symphysis bones. So these three bones together form one coxal bone in one side, and another side these three bones fused together form coxal bone in another side. So likewise, we have one pair of pelvic girdle or coxal bones. So between femur and pelvic girdle, we have seen this hip joint. So hip joint is also example for ball and socket joint. Now we move on second type of synovial joint. So that is saddle joint. Also we can use the term, it is an improper ball and socket joint. Improper ball and socket joint. Improper ball and socket joint. Yeah. So in ball and socket joint, generally like this, the joints are formed. So here ball-like structure, and this generally ball-like structure is the end of the humerus bone, and here socket-like structure to the ball, and this one socket-like structure. Hence its name came as a ball and socket joint. And the saddle joint is also like a ball and socket, but not exactly. Like that's why it is used as a improper ball and socket joint. So example for saddle joint. And generally the saddle joint present between carpals and metacarpals of thumb. It is present between carpals and metacarpals of thumb. Carpals and metacarpals. So means here carpals and metacarpals bones are nothing but generally they are present between wrist. Like for example, if you observe the forelimb bones, generally each forelimb bones contain 30 bones. Both means 60 bones. So here forelimb generally contain total 60 bones. Sorry, 60 bones, and each forelimb contain 30 bones. And these 30, how they are arranged means, so first bone is humerus, means one side I am writing, and below humerus and there are two bones. They are radius and ulna bones, and there 8 bones are wrist bones. They are called carpals, and there are 5 metacarpals bone, metacarpals, and there are 14 phalanges bones. So likewise we have 30 bones in each limb. And see here the saddle joints present between carpals and meta, and one more type of joint, that is hinge joint. Third one, hinge joint. This hinge joint provides rotation in one side. Example for hinge joint, elbow joint and knee joint. Coming to fourth one, that is pivot joint. Here pivot means, so one bone rotate over another bone. Here one bone rotate over another bone. Example, first example here between atlantoaxis joints of vertebral column bones. So first and second vertebral column, cervical vertebral column bones. They are atlanto joints of vertebrae column bone, cervical vertebrae column. First and second cervical vertebral column bone between we have seen pivot joint. One more example for pivot joint, which is present between radius and ulna joint of 4. So these are two different pivot example for pivot joint. Now we move on fifth one. Yeah, here I am writing fifth one. So that is condylar joint. Condylar joint. So this condylar joint present between atlanto-occipital bones. Is present between atlanto is the first cervical vertebral bone, atlanto, and occipital bone. Here occipital bones is a part of cranial bone. So between atlanto and occipital bones, we have seen this condylar joint. Now coming to last and most important types of synovial joint. So that is gliding joint or sliding joint. Sixth one. Gliding are also called sliding joint. So these joints, in which joints both bones slide each other, in which both bones slide each other. Example for gliding joint or sliding joint here between intercarpals bone, between intercarpals bones, or simply we can use wrist bone. Generally there are 8 carpal bones arranged in 2 rows like this, 1 2 3 4, and 1 2 3 4, like that, 4 and 4, 8 carpal bones. So between these two carpal bones, here we have seen a joint or a gap between these intercarpal bones. So this is called gliding joint or sliding joints. Hence this gliding joints or intercarpal bones also called wrist bones. And one more area where this we can see this sliding joints, that is between intertarsal bone. Intertarsal. So this intertarsal bones also we can use the ankle bone, ankle or ankle joints. So here tarsal bones are only 7. They are arranged in like this. Yeah. So 7. So in between these two, here we have seen a joint. So the joint is also called gliding joint or sliding joint, and in ankle region. So like that, so this gliding joint or sliding joints are found in two important places, at wrist bone or wrist joint, or ankle bones or ankle at ankle joints. In wrist bones are nothing but intercarpal bones or intertarsal bones. So these are the various regions where we have found this type of joints. So this is all about the entire concept of joints and its classification, means its types. So with this we have completed, and here I have provided 3 important, highly important NCRT based MCQs. So here you go with these 3 important MCQs. Yeah. So this is the first MCQs. Yeah. Read these MCQs. sorry. So joints are the essential points of contact. So it is a here. Joints are the essential points of contact between. So option is bones only, muscle and bone, bones and cartilage, and both A and C. One more MCQs, second MCQs here. Yeah. The joints present between adjacent vertebrae. Here asking about adjacent vertebrae in the vertebral column. So this is the highlight part. Highlight these keywords. Adjacent vertebrae in the vertebral column permit limited movement. Yes, it permit limited movement. So the bones are the joints which permit limited movements. We use a term already we discussed. So read and analyze it and answer it. These are classified as fibrous joint, cartilaginous joint, or synovial joint, or saddle joints. One more MCQs and last MCQs here. Yeah. So select the correct matching pair of joint type with its specific example in human skeletal system. So just now we discussed different types of synovial joint. Here talking about four: gliding joint between carpal and hinge joint between humerus and pectoral girdle, pivot joint and saddle joint. So here correct matching pair of joint you should identify, and all this about different 3 MCQs. So read it, analyze it, and drop your answer in comment box. So thank you. Have a nice day.